Okay, so the condition I chose to do is neuralgia paresthetica, otherwise known as lateral femoral nerve entrapment. Alright, so a quick index on what we're going to be going over. First, what nerve is it? The cause of the condition, any sensory deficits, any motor deficits, any occupations that can be impacted by this condition, and then any accommodations or occupation compensations that can help alleviate this condition. So what is the nerve? So the nerve that we're going to be talking about is the lateral femoral cutaneous nerve. The origin for this nerve is the lumbar plexus, so L2, L3. The course it runs is that it emerges from the psoas major, then cuts down transversely across the iliacus muscle, then passes underneath the inguinal ligament, and then is medial to the superior iliac spine. So for the action, it supply sensation to the skin for the anterior and posterior aspects of the lateral thigh, all the way down to the inferior knee. And then as for branches, there are no nerve branches. Alright, so here's a picture. So as you can see, the red right here is the nerve as it runs down the thigh. So, the cause of the condition. So, this is when the lateral femoral cutaneous nerve becomes compressed or irritated, which would be the entrapment. What traps it is the anterior iliac spine. Most common causes of the compression would be tight clothing, weight gain, direct trauma, muscle spasm, pregnancy, diabetes, alcohol use, and hematomas. There could also be post-surgical complications that can cause this condition. Some of the surgeries are hip joint replacements or spinal surgeries to the lumbar region. Okay, so here is a picture of showing the condition. It has a very good display of the nerve, as you can see. And then here is where it would be the entrapment site. And then here it has a good description of where they would feel any of the symptoms. Okay, so sensory deficits. So the first one that would be felt is paresthesia. This is the feeling of numbness or tingling. Second one would be muscle aches. Third would be sensitivity, so that would just be increase in sensitivity. Another one would be burning sensation to the outer thigh. Another would be cold sensitivity. And then other one would be touch sensitivity, so that's pain to any sort of light touch. These kind of sensory deficits or symptoms commonly occur on one side of the body, and it could vary from each individual as they'll be unique. So it could range from mild symptoms that resolve fast or severe pain that limits daily occupations. Many of the symptoms can increase after activity, so walking or standing too much, and then sometimes pain can subside with sitting down. So motor deficits. So there are no motor deficits that could be found just because the nerve doesn't have any branches, so it doesn't innervate any muscles. So that means it has no control on muscles. An individual with this condition will present with normal muscle strength. The only deficit that could be found would be a functional deficit where individual will be walking with a limp just because of the discomfort. So some occupations that are impacted, walking, standing, occupations that put the hip too far into extension, athletes, jobs that require carrying heavy belts or armor, and jobs that require certain body movements or repetitive leg movements. And then some accommodations or occupation compensations. So the first one being avoiding pressure, just because that's how the condition came to be, just with excessive pressure. So avoid any pressure that's unnecessary. Wearing loose clothing, that just ties in with the first one, where you don't want any unnecessary pressure or compression onto that site. weight loss, just because it would counteract the weight gain and obesity. Gentle movement like exercises or stretches can improve mobility and reduce tightness, so that will help alleviate some symptoms. And then ergonomic workstation, so this could be like changes to adjustable chairs, adjustable desk, or just adding more space to be able to change positions more frequently, just so you're not stuck in one position, leading to the excessive compression of that nerve. So occupation modifications would just be to avoid anything that could worsen the symptoms. Right, and that is my presentation. Thank you.